Welcome, everybody. I'm Philip Simon. I'm the director of the Interactive Media Program at Quinnipiac University. It's a Master's Science degree in interactive media and stuff like this. So thank you for coming. I'm very quickly going to hand the reins over to my partner in these, Dan Weinbrod, who will take it from here and moderate our program today. So thank you for coming. Dan?
That was very quick. I wasn't even hardly prepared. Thanks everybody for coming and braving it through the snow and braving it hopefully ahead of this weekend, which I hope will be a little bit easier on the snow front than the last one. Lord knows we've had enough of what we need. I've been really excited about this topic for a long time, and wanted to get this going here because for me, I think that healthcare is one of these areas where social media is really making, and is about to make a huge difference in the quality of lives and the way we communicate with each other, and the way we really kind of understand our relationship with with society, with healthcare institutions, and and the like. And for me, this really started more when I was very interested in the world of search and understanding, starting to do a lot of work with search engines early on, and seeing the amount of volume and the amount of intense interest around healthcare with search engines. There 77% of online health seekers say they began at a search engine when they look for information about healthcare. So, when you interface with the world of healthcare, when you have questions, you really begin now at your computer. And that's a stat from Pew Internet and the American Life Foundation or study from this year. So again, just a huge range of people. And we're seeing this grow now in the world of social media. There's a recent Price Waterhouse study that said that 40% of consumers have used social media to find health-related consumer reviews online. 1/3, and this is huge, are using YouTube, Facebook, and Twitter to find medical information, research, share symptoms, offer opinions about doctors, and the like. Controversial, interesting, a lot of different things going on in this area, an area that's exploding, that's growing as we talk about. And the area is enormous also. It's all the way from the level of people using personal trackers now, and the way that we are now tracking ourselves and tracking how many people here track their weight or their the steps they've taken every day on an app. I do that on a regular basis. Imagine how that information can become more social, more involved, more connected to our benefit, maybe yes, to a lack of privacy, maybe that also. All of those issues are things that we're talking about. And then, to me, one of the most interesting areas, which I think our panelists will talk about today, in some cases, is how groups connect over social media, and in specific disease states or disease opportunities, situations that occur. Sites like Patients Like Me, for example, and others, where what you're doing is you're taking sort of the disease state chat room kind of grouping and elevating it up into an area where people are really willing, able to share information, not only for their own benefits, but also for the benefits of providers, healthcare organizations, and and drug companies. So it's an enormous area. That ranges all the way from the provider to the large institution, and it's on the shoulders of these folks to make sure that they cover every little bit of it in this short amount of time. We got a great terrific panel here that's going to help us talk about it. They're all based here in Connecticut and doing some really exciting work that reflects nationally. Todd Bluestein on the left is the Director of Interactive Marketing and Digital Strategy at Hartford Healthcare. He's been working in healthcare for 15 years. He's worked at Aetna, Cigna, and Bay State Health System. And what he's doing now is he's leading and executing a whole enterprise-wide strategic development digital marketing plan for e-health and the e-business strategy over at Hartford Healthcare. So Todd is in the world of really moving these big giant behemoths forward in the world of digital, and that includes social media. Hyung Tan is project director and editor at Health Justice Connecticut, And previous to joining this initiative, she had worked at Khmer, did I pronounce Khmer right? Khmer Health Associates, where she managed a CDC-funded National Diabetes Project, and she's had extensive frontline experience as a community health worker. Hyung's work really is about looking out and reaching out to populations at risk and really helping connect them through social media in a variety of ways. And then Alden Hines, who's been working in the internet for years, since the 80s. So really has taken that knowledge and really brought this in now, from blogging and freelancing, covering the Democratic National Convention, now to being social media manager at Community Health Center, promoting events and causes that tell stories of improving health outcomes for underserved population. I think one of the things that, for me coming from a marketing background, is really very, very powerful about what's going on is that the role of storytelling in marketing works not only just to sell products, but also works to change behaviors and improve outcomes. And so I think that some of the work, I'd love to hear more about some of the work that he's doing in this area. So that's our group. One quick thing which I was asked to do before we begin, if you have a chance, we have a group that I'm working with that's working on a project to help build some innovation and new ideas for downtown Hartford. It has asked me to give some more, let you know about a poll that they're studying. It's a SurveyMonkey poll, and I wrote it down here. We'll also tweet it out. It's surveymonkey.com. It's a little tough, /s/downtown-Hartford. If you have a chance to check it out, if you do go to downtown Hartford, they're doing some really interesting work to help improve it, and they need some people, and they need some information on their survey. So with that, I'll hand it over to Todd, who's going to start in the morning.
Thanks everyone for having me. Excited to be here. It's great. As Dan mentioned, for myself, I've been with healthcare for quite a while, but obviously social media continues to grow and blow up, so it's really become an integral part of what we do, especially as I'm involved in marketing for external people, but also I deal with a lot of the internal components as well, dealing with clinicians, students, medical schools, those sort of things. And social media has become important for really just about everyone. Mentioned I've been with Hartford Healthcare. I've actually only been there just over 6 months, so in somewhat of a new role there. So as we start to develop social media strategies, it's very much on the very initial stages of what we're doing there. So as Dan mentioned, the statistics, these are some of the ones that he mentioned before. We all know it. People are out there every day searching for information on healthcare. Trying to connect with one another, and those are the things that we're really trying to facilitate. Again, whether it's the patients, the students, or others, people are out there. 8 in 10 look for online information for health. 44% are likely to share health experiences in social media, and that's one area that we really need to address quite a bit and pay attention to. And about a third read about someone else's health experience, and those are the things that we want to really understand and even drive some of our strategies from. But before we even go into what we're doing, as a healthcare organization as large as Hartford Healthcare, we do have to have some strategy in place. We just can't jump in there. Legal concerns, obviously a big one, dealing with protected health information and HIPAA rules, those sort of areas. So we have to have strategies in place. And strategies can be very simple. You sign up, you put your brand out there, your logo, you publish some content, and you track it. It can be as simple as that, or it can be very complex. And we tend to get a little bit more into the complex area because when developing these things, again, for healthcare, it's not just someone like myself, which, my team, it's like me and 2 people. And so when you're dealing with a huge organization, it's difficult. You really need to rely on subject matter experts and others, people that understand what people are talking about, whether it's a complex medical issue, again, on the student side, whether it's physicians talking about whether it's recruiting, talking to each other, blogging about what they're doing, you need to be able to address these things. It's tracking them, it's how are you going to respond, how are you going to deal with those HIPAA and PHI issues, human resources, so developing policies and procedures around these things, so it does become very complex. You need to be able to train people on how to manage social media. You have to give them access to the social media, education for our senior management, because as you do this, the changes today all deal with also culture changes. We have to change our culture internally. And so again, we need to change that culture because of all those different people that are online. It is our CEOs, it is the physicians, it's the families, it's the patients, it's the medical students, as I mentioned, it's the families of patients. So if our culture isn't able to accommodate that and address these things, we'll fail. So it's really, from my standpoint, what I need to do is, again, educate everyone on the benefits of social media. It's where people are, they're in the room, we need to be there with them. So again, we all have to be working together on this, not dealing with the past, moving towards the future. Everything we do is really quite ingrained with it. For example, today, some of the things we are utilizing social media for, just internally, parking at Hartford Hospital can be a bear. I'll admit it, our patients complain about it. We see it on social media all the time. So we actually set up a Twitter feed for actually even our own employees that'll alert you to what parking lots are open or closed. So as you're driving in the morning, depending on what time, I'm going to get a Twitter alert or see that something's been done that, oh, parking lot A is closed, you have to park in B. So we're using it for things like that. Even in our labor and delivery area, past few months it's been very, very busy. We figured out it was about 9 months after the storm last year. And so actually we set up a Twitter feed there as well with a lot of our clinicians and whatnot, so they know if they need to come in right away for some of those per diem or other employees. So we're utilizing it internally. And again, even during the most recent snowstorm as well, social media was a big piece of what we were using to communicate out to our patients and our employees. Offices are closed. Offices have reduced hours. Again, parking, where to park because some of our parking lots were closed because we couldn't plow them, things that were going on there. So it's really become very important to utilize these tools that people have every day. People are on their phones. So again, it's entwined in this, and for us it's really that change in culture to let people know that's where we're headed with it. Another big piece of where we're headed as well with social media and the culture that we need to educate people on is that it's not just the YouTubes, the Facebooks, the Twitters, the LinkedIns. When it comes to dealing with physicians and healthcare, Google reviews is a huge area that we need to address and pay attention to. Any physician, you type in their name, there's reviews out there. People are talking about it. There's conversation. We want to be a part of that conversation. You can't control it, but at least you can be there. You can address issues, concerns. You can point people to other areas of social. Again, as far as reviews, there's the WebMDs, Health Grades, You Compare Health. You name it, people are out there. The other piece of this as well with social is, and Dan touched on it just slightly, is it really impacts our search engine optimization as well. Search is a huge piece of what we do. It's very important as marketers. We want to get people out there. We want people to be able to find our services, find more information out about our physicians. So again, being able to understand where we're being talked about, where our information lives, being able to enhance that and grow it all helps our search engine optimization as well. as we move forward with this, and sorry if I'm going quick, you know, there's so much with social media, and one of the other pieces actually is it's culture. As I talk about culture and the changes, and it gets into policy development. And this one I always thought's funny. I saw this at a conference I was at, and it even was very similar to my experience 6-7 months ago when I started Hartford Healthcare. Someone joined to be a new social media manager. You know, they talk to their boss, they get their computer, and guess what? You can't even get on social media sites. Okay, well, if you blog about how lame you are, you're fired. You know, and that's stuff we deal with as employees. So again, part of our culture change is the development of social media policy and procedures, because things start to hit up against one another for our people that are utilizing social media. I talked about our subject matter experts. I can't be the expert on everything in healthcare. I can't talk about cardiovascular disease and heart surgeries and TAVR and all these new things that are going on. So I need to have my physicians, my clinicians talking about it. And so there starts to be that overlap between what people do professionally and personally as well. We do see that with physicians. They might have a personal blog talking about, again, what they do. Are they speaking on behalf of the hospital, or are they speaking on behalf of themselves? We need to establish guidelines and rules for people. I mentioned it before, PHI, you know, protected health information, HIPAA guidelines, and just for protecting ourselves and our brand, we have to develop policies to be able to manage these things for folks. And that's really, again, part of our growth and what we do. The biggest component of this, as far as developing policy and procedure, is one of our biggest user bases, and that's medical students. Medical students are really pushing the envelope for us as being a healthcare organization that also works as a medical school as well. We're actually I don't even know if it's announced, but I think we're going to be doing some work with Quinnipiac at Hartford Hospital here pretty soon too. But we also work quite a bit with, obviously, we're a medical school for UConn as well. And while medical students, what they're doing online, 99% of what they do is really they have very good intentions. But they're excited about what they're doing. They might all of a sudden talk about, I helped out in a surgery today. It was a young girl, did this brain tumor, we did this and this, but guess what? The outlook wasn't very good. Well, guess what? It was a friend of a friend of a friend. It got around. Someone found out about it, about the results, and not that there was really any true protected health information, but there is. It's an 8-year-old. It's a brain tumor. So it got back that, you know what, we can't talk about these things. And it's difficult for a student who this is how they communicate with one another. They're not even using email. They're using Twitter. They're using Facebook. They're utilizing other tools. So this, again, is where it's very important for a healthcare organization to really be able to have those policies and procedures and really more guidelines in place to have people, what are the rules of the road? Really, how are you going to be able to use this so it does benefit you, but it doesn't hurt our brand, it doesn't hurt our organization in any way. The other piece of this as well is within the hospital is even patients utilizing, obviously, talking about themselves. We see it all the time. Someone gets hurt, they're in there, they're taking pictures of themselves in the ER. They're asking nurses to take a picture of themselves and their patients. Well, you take that picture, let's say a doctor's in the picture or something else. Well, your name tag's there. We're not supposed to be in a picture. It's referencing Hartford Hospital or Mid-State Medical Center. It's got the doctor's name, what your role is, there's injuries. So again, we talk about guidelines and we have to establish these things to protect the patients. As difficult as it is, it's out there and we need to address it. I mean, it's where people are. And so again, its guidelines are very important, but we don't want to squash it either. You know, we want people out there. We want our brand to be talked about. Again, it helps search engine optimization. It helps present a good image that we're being helpful. All of that relates to, again, strong brand presence. So, on to a little bit more of the pure marketing piece. If you could see which audiences are engaging you, you can build ads, you can build things around this. It's a very powerful thing. And so with social media, what we do is I talk about all these different audiences, all these different groups that are utilizing it. So in that case, we have to build, we don't have to, but we took the strategy that we're going to build a lot of separate pages to address these people. Hartford Healthcare, obviously a large healthcare company, but within that we have Hartford Hospital, we have Wyndham Hospital, Midstate Medical Center, Rushford Medical Center. We have all these different places, different groups of people. People that utilize the services at Wyndham are very different than sometimes the people at Hartford Hospital, inner city versus, you know, very rural. We talk about the students, the physicians, even as specific as people with, you know, that have a specific disease state, diabetes, bariatric surgery, people that are going through those things. So we create these separate pages around these folks. We know that it's a targeted audience, and then we can really be very targeted with our marketing. We can be targeted with those resources that are helping those folks. So when we talk specifically around marketing with Facebook, again, Facebook is great for marketing because of being able to be extremely targeted. We know if you're a female, we know your age, we know what you're interested in. So we can do an ad as specific as, you know, hitting up against females that are aged 35 to 40 and are interested in, you know, a new gym. Here it is. We did an example, this is when I was at Bay State Health. We had a big program going on in our reproductive medicine area for getting people for research and then also for egg donation. It's a huge program. We got more in a month from doing a couple Facebook ads than we did in an entire year previous to that, because we could be so targeted with who our audience is. And the other piece for us as well is that's great to be able to manage it. In healthcare, we don't have endless budgets, so we could really budget things as well. You can have a huge budget and be out there all the time, hitting everybody, or you can be very targeted and say, you know what, my spend is only going to be $500 this month. You know, and as you do those pay-per-click marketing pieces, once you hit that limit, it goes away. You see the success of it, boom, you can turn it back on. So being able to address those things through Facebook ads, even Google ads, those sort of things, is very, very powerful and helps us out quite a bit. I think that's about it. So again, when we do these things on Facebook, this was just a good statistics that I saw. Most popular ad criteria. Again, we have age, we have, you know, where you're from, your interests, connections, your state, your gender, languages, education, relationships. Do you want married people or single people that your ads are focused towards? All very specific, and it's a huge benefit to us in marketing to really do that targeting, especially as we shift from traditional, put a billboard out on 84 or 91, who are you hitting against? You're getting a wide audience, but you really don't know the full impact of that. Here, we know exactly who we're hitting against, we know those results, and we'll even tie it into some CRM or customer relationship management databases on the back end. So we'll actually know if people, then we'll get a full life cycle of a person. If they went through our ad, if they made an appointment, if they had a procedure done, what was the cost benefit of that? And those are things that we're really starting now to focus on quite a bit when we talk about marketing. So that's really kind of about it, of where I was going. I didn't want to spend too much time because I know my partners here can talk a little bit more about advocacy and some of the other groups that we did, but obviously we'll be here after. I can answer a lot of other questions that you might have on things that I didn't touch up against. So thank you. You're welcome. Yep. All right.
So Todd gave us a really great landscape of how hospitals and health organizations are using social media and how I think it's a very interesting point. Perfect, thank you. I think it is a very important point that he made, that you have to kind of change the culture in order to implement effective social media strategies. I'm going to talk more about advocacy and connecting communities and people. And Alden and I work closely together on the issues of racial and ethnic health disparities. How many here are familiar with that term? Okay, there's no way that you can really tweet that, and so we use various terms called health equity or health justice, and that's what health justice CT implies, is giving everyone an opportunity, an equal opportunity to be healthy. It sounds really simple, but there's a lot of complications in terms of what makes people healthy, what makes communities healthy, and this is what we discussed through Health Justice CT. To give you a little background, my background, I'm not a communications person. I think I've grown to become a communications person through this project, but my background is actually in community health and organizing in the community, and several years ago, I think, I still keep it in my bio, I worked for a community-based organization for 8 years, and I worked with refugees and immigrants, trying to give them access to health care. Access to health care is not necessarily insurance, and I know that we're going through a very big year through healthcare reform this year, and it's very complicated, and people are still trying to figure out what's going to happen next year in 2014. But when you are, when you have limited English-speaking abilities and you have other issues such as transportation, food, access to healthcare is not that easy, and I used to spend hours at clinics with my clients waiting to see a doctor. And at that time, we were using cell phones, and everyone was using cell phones, and I didn't have access to Twitter. But as a health navigator, I was thinking, wow, if I had access to Twitter, I will be tweeting my policymakers at this point. And the fact that I'm waiting 2 hours to see a doctor, that's what I'm going to be doing. And so when this job opportunity came across my board, I didn't have a communications background, but I did know what it was like to work in the community, and I did know what it was like to organize in the community. And the intersection of communications and organizing was something that I was really interested in. And I think this is what makes this project effective in understanding kind of your community, but also understanding some strategies that communications folks use day to day. So Health Justice CT is funded by the Connecticut Health Foundation. I'd like to say it's more so a cooperative agreement. You know, the foundation several years ago thought, before the hype of social media came and Facebook and 6 million users on Facebook came around, the foundation thought, wow, social media will play a huge role in advocacy, and they were right. And so our goal is really to create a movement and increase awareness about these issues that are impacting the community. Originally, our audience was, they were underserved communities. The audience was to reach LEP patients. They were to reach folks who can't access health care, who are, for one reason or another, have health issues that need addressing beyond the healthcare system. And so that was originally our audience. But then we realized that as advocates, there are 2 types of audiences. There's the consumer base and there are the advocates. And with limited resources, we really needed to kind of focus on an audience that can speak on behalf of a community. And this is where it comes in, where the social networks are better for public interest. I'm sure you're all aware of Change.org and some of these advocacy campaigns, and they're widely effective mainly because people trust nonprofits. They trust pairs. Social media is effective because you value the opinion of your friends, your neighbors, more than, let's say, no offense, Todd, a hospital, right? Yeah. But next to the hospital, they do value NGOs, they value organizations, and this is why creating movements really favors, has to come from the bottom up. This is why the most effective movements come from a story. There's a study done just supporting the fact that NGOs are the most trusted source compared to other sources like academics or doctors. So the advocacy landscape over the last couple of years, for me and for other organizations, has really changed, and this is how. The way things were before, how many of you do kind of political advocacy or kind of local? A couple. Well, unlike before, you have access to your politicians. You have access to stars. You have access to people who are called influencers, who have the power to create change. Campaigns in the past, remember, you would sign up for an email blast, and what would happen is the campaign would ask, hey, guys, can you please email your Congress to do this and make sure you support this bill? And the email communication was a very close communication loop. And this slide, I have to say, I've learned from, was taken from the Center for American Progress, just to let you know. So it was a very close communication loop. You'll notice that this communication loop did not involve the public. Advocacy right now has changed because campaigns are not only emailing consumer groups, but it's being shared with the public. And I'll give you an example of how this was effective for a lot of health organizations now. So campaigns were emailed to activists and promoted through social media. Not only are they being sent to activists, but they're also being shared on social media and then targeted to the influencers. So before, if by chance the consumer sends the email to the policymaker was like, oh great, I get another email, whatever, no one sees it. The difference is that, yes, the activist sends the email, the Congress gets it, but they can't ignore it because now social media is into play. And not only is that email sent to Congress, it's sent to everyone else and shared via Twitter, Facebook, and everywhere. And I'll give you an example of how that happened. Last year, do people remember the controversial Komen Planned Parenthood split? Do you remember that? Trying to get the issue of racial and ethnic health disparities on kind of the state or national platform is really challenging. And what we've learned over the last couple of years is that you have to attach your issue to a larger issue that people would understand. And I'll explain the Komen, and I'll talk a little bit more about that. But with the Komen split, the reason why Congress was involved was because there was this outcry publicly. Originally, you would not hear policymakers or politicians talk about, whether Komen was going to fund Planned Parenthood. They would probably have stayed out of it, but they couldn't because of the public outcry. And this is exactly why the framework for advocacy has changed over the last couple of years. So your online advocacy channels is no longer just on email marketing. And I have to say, email marketing is still very important because my colleagues and I really struggle because, not everyone is on Twitter, not everyone is on Facebook, and as much as I try, there's still some resistance, but we're getting there, and there is an improvement on that. So online advocacy channels are emails, your website, Twitter, Facebook, telephones, online ads, games, earned media. Games I'm still exploring. I really haven't seen effective gaming in my field of work yet, but I'm really interested because there are challenges for mobile apps popping everywhere, and we'll talk about challenges in a little bit. So, yeah, it's true that social media reaches a lot of people. It has the potential to reach a lot of people, but through this work, I've realized it's not the amount of folks that you reach, it's who you reach is what's important. So most importantly, you have to reach the right people with advocacy campaigns. And with our work in health equity, it's challenging because we're still trying to figure out our ask. We're still trying to figure out what do we ask people to do. With healthcare reform, it's a little bit different with healthcare reform because there's that policy aspect. With health equity, you want to level the playing field for all the folks. So we're still trying to figure out that message, but we do target, we know who our influences are. And this year in particular, because resources are reduced or raised, nonprofits and health organizations, we don't have, as Todd said, we don't have the marketing budget as a lot of Fortune 500 companies. So basically, we've got to target our resources appropriately. And so right now we're trying to create a network of health leaders, of health equity leaders who can talk about the issues. The next steps are our policymakers. You know, we haven't gotten there yet, but what if we all met at the Capitol and we tweeted our senators all at the same time? I'm telling you that Chris Murphy, Senator Chris Murphy, now Senator, and Senator Blumenthal's not so much on Twitter, but Chris Murphy, he tweets on his own. He's on the floor, he's tweeting, he's giving his own opinion. If he gets 100 tweets from 100 people about a specific campaign, he's going to know, being like, maybe I should pay attention. The same thing with Governor Malloy. So your access to influencers, your access to people is much different than where it was before, 5, 10 years ago. When I got out of college, and I can say when I got out of college, it was emails. You'd be lucky if an aide at the offices would open your email. You wouldn't even know if they did, or if they got the fax or whatever. It doesn't matter this time. If they don't, you're going to share it publicly. So yeah, social media can create change. And so how do we use social media to raise awareness about racial and health disparities? One, we don't use that term anymore because it's just too long, it's too cumbersome. And by the time I explain to you what it is, people are like, all right, I'm leaving now because I really don't know what it is. So we're still working on our messaging with that. The other thing, what's really important for us is content. People sometimes ask me, they're like, oh, I want to learn how to use Twitter, I want to learn how to use Facebook. But if you're an organization, especially if you're a nonprofit organization, you typically do not have a designated person. You know, the community health center is lucky enough to have Alden. Not many folks have a specific communications person to focus on social media. So what you have to do is that instead of creating 1, 2, 3, 6 separate strategies, sorry, 5 separate strategies, you have to focus on your content, and that's your web. And Todd talked about that, about trying to increase in creating content from your web. And you use social media, you use the various tools to share your content, but everything is from content. I always think about when you create your marketing strategies for whatever organization, you think about your content, and you think about how your dissemination plan is going to work for that. So basically, my role is really to keep the conversation going and heighten awareness around this issue. And we do keep a blog, and our blog is really run by volunteer contributors. We have contributors who volunteer their time to submit. We have guest bloggers coming in. And the model's effective. It's not the best with volunteers because there's a lot of various accountability things, but you know, I like to think of it, it's kind of like the small Huffington Post, effectively, you know, now look at where the Huffington Post is with volunteer writers. You know, as Todd said, you know, we go where the fishes are. The old paradigm is that you create this health fair and people come to you. With social media, you go to them. You always go to the conversation, and an example of that is, I think organizations or governmental organizations, public health departments, they struggle with reaching limited English-speaking populations. You know, Latino communities, and they always think, oh, well, we just translate our materials into Spanish. It's not that. It really is not about translating, because if you think about it, if Latinos are on Twitter, they're tweeting in English. And so you're not going to tweet in Spanish. You have to do your research about who your audience is. You can't tweet about Spanish. Most of the time, the Spanish translation is incorrect, but you have to tweet about what's culturally appropriate. The language is not about translating language. It's about translating the context of what your message is. And so you have to remember that about your audience. You know, CDC, a lot of federal governments have been thinking about how do we reach limited English-speaking populations, and their first thought is always to go to translating language into their culture, and that's not necessarily going to be the most effective. Because I'll tell you, when I was working with Cambodians, you translate it on Twitter, Khmer languages, I'm telling you, the elderly client that I was with will not be reading it. So you have to think about how you're going to do it. We talked about the Komen and Planned Parenthood success story, but I've been pulling my hair about how to get this issue elevated at the state discussion level. And sometimes you kind of have to go where the conversations are. Last year, during the Komen split, we didn't talk about the Komen split, but one of our contributors talked about how the split impacted women of color, how the services impacted, how the situation impacted women of color, or could impact women of color. And with just that one hit, with the right hashtag and the right time, we had over in 1 hour, we got 600 hits over that one blog. One of the other things that we've been trying is also healthcare is most people think it's, conversational. It's always the left wing who's talking about healthcare reform. We want healthcare reform. So for us, we always thought about if we were going to ever create any political traction, we have to have both sides of the conversations talking. And so we're open to both sides of the conversations, and some of our contributors have different opinions, and this is what we prefer. We're open to that. We're open to folks having different opinions, having conversations, and so we do have both political affiliations represented on it. I'm not going to go through blogging tips. This is really funny. Someone once says that engagement is key, but size isn't everything. We were lucky to work with one of our consultants, Katie Payne. She's kind of known as the Queen of Measurement. I don't know, but she's referred to as Queen of Measurement. And the funniest thing she's always once said to me, she goes, "Engagement is good, but it's not about the size that defines your engagement." And so while Charlie Sheen at the time, he has a huge following, but is that type of attention and negative attention really going to drive any positive action to happen? No. So think about your engagement. It's not about the size. It's about who you're engaging with. You all know how to use Twitter. My Twitter is HeungTan. I tried to tweet from it. It's HeangTan, and then Health Justice CT. And Alden and I have been trying to tweet using the social media breakfast CT. We also started an informal group called Healthcare Social Media. If you're interested in having this conversation, continuing the conversation with us, because when we first started, very few folks were kind of on the Twitter field talking about this issue, and so we knew that we needed to build kind of a mini coalition to support each other. And so the hashtag is Healthcare Social Media CT, and Alden will talk more about that. But this is kind of the anatomy of a tweet, of a successful tweet. I'll tell you, my tweets do not all look like this, because this is the ideal tweet for advocates. So you always want to target a person of influence if you're trying to get them to do something. So you get their attention, and then you tell them briefly why they should pay attention. You put a link. You always use a link. And then you copy someone who is kind of a watchdog or an alert dog, or someone who's going to hold him accountable, and that person particularly is just a newspaper writer that we happen to have a relationship with. And then you use a hashtag to expand your reach. Okay. So what do we do here? We always use with the issue of advocacy, we're always trying to tell a story. And I hate this photo. I think Jen Wynnum in the corner took this video of me, and I really hate it, but I wanted to kind of walk the walk, or walk the talk. I don't use these terms correctly, but I wanted to say, okay, we're recording, and when you're creating stories, it's not necessarily on a blog. We've expanded to video. We're doing some podcasting, and so there's so many different ways you can tell your story and share stories. And so at Health Justice CT, it's basically a team of one, which is me, and then we have various volunteers and consultants helping us. And so we knew that we couldn't address or tackle this issue alone, but we wanted engagement, and so we created this challenge called the Health Justice CT Challenge, where we asked folks to submit in video what their ideas are to address health disparities in Connecticut. Got a lot of resistance last year. I had to handhold a lot of folks last year because they're like, video, grant writers would call and say, this is a lot of work, you know? I'd rather write a 10-page proposal than submit a video. But the idea with these challenges and grant proposals is that social media is about being social. So we wanted the public to have a voice in who gets the $10,000 prize money. And so that's why we asked folks to submit their ideas on video, because how many here would actually go and vote and read a 10-page proposal? Exactly, and so we initiated this challenge because we wanted to combine solutions and then get the public involved in these solutions. Dan, I don't have time to show my video, do I?
How long is it?
Go ahead.
How long is it?
It's 3 minutes. I'll just show parts of it.
Sure. Yeah, 3 minutes is fine.
Okay. This video didn't win, but I had picked it because, I'm sorry.
You need to go to browser.
Yeah, I have to click on that. This is one of the stories that came in the community. This video didn't win, but it was a great example of just giving the power back to the community and having the community create a solution. And they were able to share a story of what was going on. It was not professionally created in any way, but it was very powerful in their messaging. We'll see a little bit of it.
Audio-wise, see what happens if it comes through the house system. Yeah, it's going to. Oh,
Ironically, the Health Justice CT Challenge submissions deadline is today at midnight. So if you could get a video, you can. The website is healthjusticectchallenge.org.
Ready to go.
Okay.
Well, I just feel like around here in Crystal High Rise, it feels like it's just us. Like we're secluded here because we're low income and we're not really that important to the town.
Do you know anyone that's ever had a heart attack?
My aunt and my grandma.
Okay. And was there anyone there that was CPR certified when they had their heart attacks?
No.
There are very few people living here who are CPR certified. There are no AEDs in any of the buildings. And there are people here who want to learn how to operate an AED. There are people here who want to learn CPR. There are people here who want to participate in programs that will keep them healthier. But they lack transportation. They lack child care. What do you think they're scared of?
We're scared of like stories that people tell about things that happen on Crystal when it's not really true.
Yes.
They pass out rumors saying that there's a lot of violence and stuff around it, so they don't want to be near the violence.
Okay. Health justice means that everyone, regardless of your location, regardless of your socioeconomic status, regardless of how much education you have, regardless of your employment status, regardless of your citizenship, everyone deserves the same access to healthier choices. Through this Health Justice Connecticut initiative, an AED, automated electronic defibrillator, will be placed in each one of the 3 buildings at Thames River Apartment Complex. Additionally, free CPR training and certification classes will be offered to any interested residents.
But the Health Justice CT Challenge allows stories from the communities and solutions from the communities to come.
Well, I just feel like around here in Crystal,
okay.
It feels like
to come and to come to light, and people were able to vote on which projects they wanted to fund last year. We had 7,000 votes come in last year, and you know, it was success in terms of engagement, and we're doing it again this year. We've learned a lot from the previous year. We're doing it again this year. I think my colleague Chauvin Kinney this year as well. They had submitted a text messaging campaign last year, and they also weren't funded. You're wondering who won, but actually a group of college students won. They built a community garden in Hartford, and were able to mobilize the residents to build community gardens in there. But this text messaging campaign was one of the ideas, was to allow consumers to text their ideas, their challenges, whatever they want about what they're dealing with the new healthcare reform. And it's going to be a particularly interesting year this year, because everything is things are going to hit the fan next year in 2014, that's for sure. And so take down this number 24587. Text to be heard is a great campaign. It's one way to voice your opinion about healthcare reform. I know all of the testimonies are going to be captured and shared to policymakers at the end, and really it's going to drive some of the enrollment processes and help us out. But these great ideas come from the community. People share them, and this is the power of social media and advocacy. So, to end, use your social powers for good. There's so many ways, because you, unlike before, have really a huge audience, and those are your friends and families, and you have a lot of influence over them. So use that time for good.
There we go. So, with that, let me start off. Dan had mentioned that I've been on the internet for a long time. The earliest post that I can still find that I put up on the internet is from 1982. I've been on Twitter longer than anyone in Connecticut. I like to innovate. I like to try new things. And so I'm doing that here. I hate PowerPoint. So I'm not doing a PowerPoint presentation. Instead, what I've done is I have my talking points on Buffer app. Any here people use Buffer? So the thing that's nice about Buffer is you can set up your tweets ahead of time and share them. And then using tweet chat, since I'm sharing them with the SMB CT hashtag, they will show up here. The one caveat is that tweet chat takes about 5 seconds for an update. So in about 5 seconds, my first point will be coming up here. And with that, I will come up with the next one. And well, so there it is. Hi, I'm Alden Hines from CHC Connecticut. And from Healthcare Social Media CT, Hyun mentioned that. There's a few other people who are involved with that. We have a monthly meetup. We have a weekly tweet chat. I encourage everyone to check it out to talk about how you can use social media for healthcare here in Connecticut. Also, being the early adopter of everything, I'm sort of everywhere on the internet. The link provides a link to a thing called See Me, which lists about, I don't know, something like 40 of my social media profiles. And I encourage everyone, join the discussion on Twitter. This is live. If you tweet something with the SMB CT hashtag, it will show up there within a few seconds. And with that, have a question? We can make this a little bit more interactive of a discussion. So I've mentioned using Buffer and tweet chat. The other part is that I used Evernote a fair amount for gathering my information, sharing it between devices, because I end up using a lot of different things at the same time. I want to just follow up on what Hyun was saying about social justice, health equity. here's the thing. Hyun talked about the difficulties of getting treatment if you're having a heart attack in projects in New London. There's a lot of places where health equity is a big problem in Connecticut. As an example, if you're a black woman, the odds of your child surviving infancy are, well, white women's odds are twice as good as yours. In fact, your odds are worse than women in Botswana. Think about that. I'll just leave that for a little bit on the health justice sort of side of things. There's been a discussion about knowing your audience. When I started at the health center, I thought my audience was going to be mostly patients. And Todd spoke an awful lot about marketing. The marketing is marketing towards patients. Our population is, our patients are mostly Medicare, Medicaid, uninsured. However, 70% of them are on social media. So we can in fact meet them on social media. More likely, they're going to be on social media on a smartphone than they are going to be on a computer. So it's really a question about what form factor are you using, whether or not, and not whether or not they're on social media. That said, my first day at the health center, I'm sitting there, I'm filling out all the forms. This woman comes up to me and says, "Are you Alden?" "Yeah." "We're so glad you're here." And I'm thinking, either they've got this very energetic intake process, or there's something I'm missing. And she goes on to explain that she is in charge of recruiting. And trying to hire primary care doctors is a challenge. There's a shortage of them right now. Trying to get ones that want to come work at a community health center and not make as much as they would in private practice, that's a big challenge. So one of the things that's been very important to me is getting the story out of what makes working at a health center so special, so that people say, yeah, that's where I want to work. And some of the stuff Todd was talking about, I don't know if you mentioned it in your talk or if it was before, about how to reach out to some of the potential new providers, right? We talk a lot about employee wellness on our Facebook page. We've got an album dedicated to our employees that, you know, go out and run triathlons. We've got a page dedicated to our employees that are doing important social outreach and communicating that, yeah, this is part of what being an employee at CHC is about. Another important audience for us is our policymakers, and Hyun talked a little bit about that, and I'll talk more about that one in a little bit. And so typically when I do this presentation, I often throw in partners and patrons as other folks that we focus on as part of our audience. We're not doing an awful lot with the patrons right now in terms of dealing with partners. That's some of the healthcare social media stuff. But with that, I think we want to move on beyond thinking about audience and message to one of the biggest challenges I face. And it's, again, something that Todd mentioned a little bit. He talked about HIPAA, PHI, concerns that professionals have about being online. And often their associations will have ethics statements about, you know, as a family practitioner, you cannot friend a patient online or stuff like that. So there's all kinds of messy stuff like that. When I started at CHC, my first day there, I didn't have access to social media. Again, it's social media manager, I couldn't get in. We ended up spending a lot of time, as Todd was talking about, dealing with our policies. What are the policies about social media? What are the policies of staff, of patients using social media? But I want to focus beyond moving beyond mission and audience to building the team. And so with that, we've been getting, it's taken me about 1.5 years, 2 years, to get people to actually start writing stuff for me for the blog. If you go out and look at CHC's blog, it started about 2 months after I started. And for about the first year, I wrote just about everything. And then I started, I'd start getting like an email that was really good, and I'd say, hey, can I put this email up? And so I just put up, you'll see some of the posts. The following is an email that I received from Margaret Sanger about such and such. And so I started doing that. And then slowly people are saying, hey, yeah, I want to get my stuff up there. Same sort of thing has been happening with Twitter. And I think the best example is our chief medical officer was speaking at BlogHer about a program called Text for Babies. She's a national spokesperson for it. She went to BlogHer and she knew nothing about BlogHer, and she's avoided social media. But interestingly enough, her brother's a fairly substantial rap musician who has like 40,000 followers on Twitter. And so he and I tag teamed her to get on Twitter. Just do it for while you're at BlogHer, because everyone at BlogHer is on Twitter. They'll really like that. And she did, and she got this phenomenal response afterwards, and she's become one of our most active users of Twitter. And so then once that happened, now everyone else is starting to say, hey, gee, maybe I should be on Twitter as well. And with that, we've started, I'm a big fan of tweet chats, as you can see doing this here. And with that, we've set up a tweet chat for one of our patient or doctor education forums that happens every week. So with that, the expectation became that all the doctors would start setting up accounts. This presents another interesting issue. We've got now a fair amount of our providers on social media, so I need to track all of that. And there's also the aspect, oops, that didn't do what I wanted. This is not behaving properly. There we go. Okay, so one of the problems I ran into is just keeping track of everyone. And so I've started using lists. Who here uses Twitter lists? Okay, we've got some people. So I have a Twitter list of all the CHC staff, and I can go to that list and see what everyone's tweeting. The Permanent Commission on the Status of Women has a Twitter list of about 40 or 50 of the state representatives who are on Twitter. Really important if you're doing policy type stuff. Let's see what the state reps are talking about. I've built a similar list on Facebook of the state reps who are on Facebook. And so with that, those are links to some of the different lists that I've done. So it's making lists on Facebook, on Twitter. On Facebook, it's you set it up as an interest group is what I found works really best. So with that, how do you get your providers, your staff online? One of the key things is start small, get them to just lurk, right? Have them listen, give them some examples of people to follow, and let them do that. And eventually they'll start deciding, well, maybe I'll step in. To me, I like to always talk about how social media is like a cocktail party. And the first part of that is, so think about behavior cocktail parties, right? First off, if you're kind of new, you don't know anyone, you may kind of stand around, you may listen, spend a little bit of time getting a sense of what's going on, and then you join in. That's a great way to get people started with Twitter. Another thing, everyone complains about hating to see what, this guy tweeted that he had oatmeal for breakfast. Do I really care? Well, you know what? I do. And here's why I care. Because when I run into somebody and I want to talk with them about something important, what's the first thing I say? Do I start off saying, so Hyun, about Senate Bill 377, I really think, no, you don't start off like that. You say, hey Hyun, how's it going? How was your drive this morning? Well, hey, so I tweet about my drive in the morning, right? You talk about those sort of things before you jump into the substantive discussion. So that's why I am a big proponent of tweeting about breakfast, tweeting about the commute. It's like how the cocktail party works. It's how conversations really work. And social media should be conversational. Another interesting issue that comes up, and again, Todd touched on this a little bit, but think about branding, and when you're thinking about branding, who's branding what? I have my brand, A Heinz 1. Okay, by modern standards, that's not a good thing. You know, you want a name it's like my first initial, my last name, the number 1 added after it. Back in the 80s, 90s, when I set that up, that was kind of about the way things were done. But I have my personal brand, a brand that's been on Twitter longer than anyone in Connecticut. I've got like 4,500 followers on Twitter. I've got a much stronger brand than the community health center where I work. It's going to take me a long time to get the community health center up to the same brand. Part of it is, well, you know what, let's get Dr. Nwando. Dr. Nwando is our chief medical officer. And she's been doing a very good job, I think unconsciously, of developing her brand as a primary care provider, national spokesman on various issues, and at the same time she tweets a lot about CHC, so she's building her brand while building the CHC brand. So you want to think about that. I like to encourage people to have their own brand that they relate back to the brand that you're a part of. And again, when you start talking about hospitals, you get the thing of, well, you've got a doctor who has his private practice and writes at the hospital. So, you know, he's going to be thinking about, okay, whose brand am I promoting? What am I getting out of that? And then with that, the other key point is to remember it's about great, Amanda. Let's talk about the granola bar a little bit later. It's about conversation, right? And actually, this kind of fits in nicely. You know, she talks about that, and we have a conversation. Social media is social. It's about the conversation, and you need to keep that in mind in all of your social media stuff. So with that, that's kind of, remember, it's about content. Hyung stressed that, and you cannot stress that enough. It is about content. It is about curation. Somebody, and you'll see, if you look at some of the stuff that I tweeted earlier on, and you'll see that Connecticut Health, Health Justice, they've been retweeting other people. It's about curation. That's how you get some of that. And then the other part is, it is about community. It's about a social setting. We're all hanging out together, working for common goals. And so that's really the key things that I wanted to talk about. So with that, I know that we're running kind of late, but I think it's time to move on to questions.
I think we can do that. We got about well, we certainly have time. We're slated till 10. I don't think the room is closing up. So I just you know, I had a few questions, but then I think I'll throw it out to the folks in the audience. The biggest one is really the issue that everyone kind of touched about is the whole question of privacy, HIPAA rules and the like, and you know, where do you see this going? I have a doctor friend of mine who has a blog, who's been asked to take it down or to stop blogging because he may be talking about things that may reflect upon his patients. So where do you see this thing going? Is this something that you encourage, see less of happening, and the like?
I view privacy as a very big red herring. There are more HIPAA violations that take place at the water cooler in the hospital or in the clinic than ever take place online. If a patient writes about something, HIPAA doesn't apply. It's only about if the healthcare organization. So that's one. Now you do get into the issue of what happens if a patient takes a picture in the hospital, which happens to have somebody else in it, and that technically still isn't a HIPAA violation because the organization has not done it. It's a privacy violation. It's not cool. You can have your policies, and we have policies similar to what you talked about. In terms of healthcare organizations asking a doctor to take down something, that probably, if I were in an organization like that, it'd probably be the message is, oh, I want to work somewhere else. And with the demand for doctors being what it is, healthcare organizations that make those demands are going to be hurting themselves. So I think that's fairly foolish. And actually, as a side, do people follow the case of the doctor in Minnesota who sued a patient for giving him a negative rating on rate? It got thrown out, went all the way up to the Supreme Court, the Minnesota Supreme Court, and just got thrown out, and the doctor now has to pay all the legal fees for the person he sued. And that was based on an issue of defamation. And the key aspect of that is when somebody's stating an opinion, that's not defamation, right? And the patient said, this guy's a real tool.
Where do you see it going?
Same thing. There's so much gray area with this, and where I see us going is continuing to kind of push that envelope. Patients are looking for more information, easier ways of communicating with physicians. However, in a lot of cases, physicians are almost scared to do it because of those policy issues, not just our internal policies, but the HIPAA and those sort of things. So where we're headed in order to address those sort of things, they look upon us and, for instance, our areas to be able to provide other tools to even be able to do these. So maybe possibly it might not be the Facebook as we know it, but it might be a Facebook-like application within a patient portal, within a secure area where physicians and the patients have access to the records. They're looking at their records. They can converse about them within a secure area. So that's kind of where we're headed with some of those sort of areas and investigating the best way to address it.
That's really very interesting. And a question for Hang. You talked about advocacy and reaching out to influencers and the power of, say, someone like a Chris Murphy getting 100 tweets, all of a sudden and really focusing and paying attention on that. Now, on the one hand, I think that one of the biggest differences that social media has brought on is this incredible level of transparency, where I think everyone's referenced it at one level or another, where you can get directly to people. Do you think that's ever going to sort of fade at a certain point where somebody will say, oh, ho-hum, it's another 100 tweets from so-on? Or is this really a change in the way that we're able to conduct advocacy, that they'll stay?
I really think there is a change, and it's about volume and who tweets them. I think the more popular you are, the more followers you have, and you can't possibly address all of the concerns, or you can't possibly address all of the issues that are being said about you or your brand. But if there's enough volume and there's enough outcry, like the Planned Parenthood situation, you really can't ignore it. So I don't think it's going to go away. The transparency is going to be there. I think, perhaps down the road, people are going to complain about too many things, but the real issues will have more weight.
Let me add one aspect of that, is there's a whole area of astroturfing. Right? People know astroturfing.
Yes.
The idea grassroots is, but astroturf, somebody else is driving it. And you know what? Legislators are smart. If they get 50,000 tweets that all say exactly the same thing, they're going to know that, gee, there's 50,000 people echoing this one person. If they get 100 tweets, which are all saying kind of the same thing, but a little bit different, it's sort of like there's 100 people who are thinking seriously about it. And that's what they're more interested in, is how many people are really thinking seriously about an issue.
There's one example last year that came up with, did you guys hear about the taco? Do you remember the North Haven Bay Area?
Oh, sure.
Oh, yes.
Oh, yeah. So I think it was the National Immigration Forum, and they had connected with a local Latino community organization down in New Haven, and they basically didn't pay any money. They basically put up this Facebook being like, text us if you think this is wrong, and we'll send a taco for each text. We got 5,000 tacos text to them. This is an existing text messaging campaign, because I'm scratching my head. I was like, how did they all organize so quickly? But it was an existing text messaging campaign, and they put up this Facebook message, and it was a national message. And I mean, the mayor escaped, and he was embarrassed. He retracted his statement and apologized. And, you know, and they were able to send the tacos to a homeless shelter afterwards. But, I mean, that's the power of social media and the change. And if people care enough, action will happen. So
and you bring up a really interesting point, you know, where one of the things that becomes very effective in social media is speed.
yeah,
And we
it's
see
sweet.
that happening. We see Oreos during the Super Bowl, you know, things like that. If you're really aware and on the ball, you can really make an impact.
And to follow up on that, for us, it's not that we'll get 1,000 tweets or Facebook messages on something. It might only be a few, but the fact that we need to respond, and we have different guidelines on how to respond, when to respond. Do we wait for the public to kind of correct itself if it's wrong information? When do we jump in? But the power of being able to respond and address things, even if it's a negative, and saying, oh, we hear you, connect with us offline, people appreciate that, and that really goes a long way. And so, again, we talk about resources, things like that. We have to be on the ball and be out there paying attention to those things.
I don't know, I would think that the hospital really needs to be more open with that. Really, I mean, I don't know, I have some illnesses, and I've been in the hospital or not, but from the things that you tell me, I really think that they should be more open, although I also understand being that I'm a communications person, and I understand really anyone who takes any pictures of anybody, they ought to have their permission first before that.
Yeah, I mean, we do that if we take something on behalf of, one of the hospitals. We definitely ask, permission.
You have to have their permission.
We have to have their permission. Right, because one of the biggest things that provides great impact is patient stories. We always ask patients, especially good things. I'm sure you all saw the Colby Salerno stories, the heart transplant. Kid who lived at the hospital for almost a year until he finally got a heart transplant. We utilized a lot of his patient stories. There's other things as well, but we always need to ask.
The only thing I can say is, like, I wrote a story about when I was in the hospital. The only thing I did was I took a picture of my hospital room, but I wrote a story about being in the hospital and stuff that you should have in the hospital. The only thing I used was my room. It's stuff that you should bring, and
Yep.
so no one was hurt, the hospital wasn't hurt.
Yeah, no, you're correct.
Question?
So I have a question. I am brand loyal to Hartford Hospital. I am an adult patient with cystic fibrosis, so I am part of the patient-centered medical home around that. And a couple years ago, my doctors felt really strongly that they should start a blog. Hartford Hospital told them no. Since now, they have one static webpage that they're so excited about, but it's a picture of them. The news never updates, nothing. Now, I realize, hearing from you makes me realize I haven't checked in to see if you guys have evolved yet or not. Are you allowing your, I understand, believe me, as a patient, I understand the sensitivity. I have been in the healthcare system, I hope more than everybody else here. So if you can beat me, I'm sorry. So I get it. But how are you guys like, I mean, you come along.
Yeah, we are evolving, and like I said, I've been there 6-7 months, and the first person in this role to really start to address these sort of things and work with different medical directors to understand really, number one, where are we, what are your patient needs, what are your physician needs. And so a big piece of what I'm doing, which really isn't very public, is first, we need the foundation to be able to support these things. So you talk about a static web page. Outside of social media, actually the main thing I manage is the fact that within our organization, we have over 30 websites, all managed on a different platform, different vendor applications, and it's almost impossible to be able to manage. So we're developing whole new content management systems, things like that, so we can begin to, guess what? you know, within an hour we can build a cystic fibrosis site, have people where there's blogging capabilities, conversation, connect to other health information. So a lot of what we're concentrating on now is really just that infrastructure and foundation to be able to build these things up, develop the policies and procedures, and get the resources. So once this stuff's ready, we can begin to really push that envelope. And that's, you know, I talked about culture. It's letting management know, because these things aren't cheap either. And, you know, so, and we struggle with that every day.
Well, one more question.
Yes.
Would more pressure from providers saying that they want to assist you in your...
It helps prioritize things. Yes.
Advocacy.
Advocacy.
I already know that in some ways that people want it, because there are forums out there all the time that really say that people want it. I have Crohn's. So there are Crohn's forums where people are asking questions, and they're asking questions because they're not getting the information that they want from their doctors. And they don't know anywhere to ask, so they're asking other Crohn's people, because they're like, is this what's supposed to happen? I'm asking the doctor's not telling me enough of what I need to know.
Yeah, that's right. I think that, you know, they talked about advocacy as well, and where there are a lot of, you know, some of the things we promote even sometimes are those separate groups outside of the hospital where there are like patients and people that understand the diseases talking about those things, sharing their experiences. We want to pay attention to that and help out where we can and chime in with expert advice and whatnot, but that's where we do see a lot of things going, and eventually we will, you know, build up to that and provide separate pages and information to, you know, to help folks out.
You have a question?
I just, since we were talking about information, wanted to mention that I think the taco situation happened in East Haven, not North Haven.
I'm sorry.
I don't want defamation of the North Haven.
Thank you for clarifying.
Yeah, in our heightened awareness of internet security, where is social media vulnerable, and how is, if one is running a social media program, how do you protect from both something on more of the hardware side versus something more subversive?
So a couple things. Did you follow what happened to Burger King recently? Right. So number one thing, have good passwords. Right? Whopper one of my favorite tweets. Whopper 123 is not a great password. But to a certain extent, there's you can harden your own stuff. But, and my father worked in military intelligence a bit, and there is this whole EC3 thing that no matter what happens, the other side's going to come out with something more powerful. So with that, what do you need to do? Probably the most important thing is you need to plan ahead and be nimble, right? And the nimbleness, it goes back to Oreo. Oreo was brilliant, as was PBS with the lights are still on at Downton Abbey. You know, so you need to be nimble, and that's one of the places where policies end up being a real problem, because they prevent you from being nimble.
Yeah. And to address, you know, on the technical side, well, first, that's where we do have challenges in being, you know, opening up within the healthcare organization, because within our firewalls, there are so many applications with so much patient information and secure things that social sites, whether it's YouTube or Facebook, they're, you know, those sites present and, you know, have some of the most, probably some of the most malware and other vulnerabilities. And so that's why we are very cautious about opening up social media to an entire organization. It's only a select few who need it for their job. So we have very strict firewall and other other technical ways of being able to prevent people from coming in.
What about the second part of my question, where the attack is from the outside trying to subvert your message?
Well, one thing that's very funny that happened as a result of what Alden mentioned with Burger King, there were a number of other sites that were hacked, and then MTV and BET hacked themselves, and because it was sort of cool to be hacked in a way. So I mean, in a sense, separating it on an outside level from sort of your core functions is one way of dealing with it, and then you can even, to a certain degree, kind of go with the flow. But I don't know, if you have any other thoughts.
Well, the one, that hacking themselves, one of my favorite stories is it's not quite the same thing, but it's taking a self-inflicted wound and turning it into a silk purse, which is what happened with Red Cross. I don't know if people remember the story of one of the social media people working for Red Cross. It was, Friday about 4 o'clock and tweeted something about, it's been a long week, I'm ready to go home and have some, and I forget which brand of beer it was, and it said, do that and get...
Dogfish Head. Dogfish Head,
right? And with that, very quickly, again, being nimble, grabbing the opportunity, somebody said, they got on and said the person who tweeted that has been sent safely home. We make sure that no one tweets, no one drinks, tweets, and drives. And we encourage people to responsibly enjoy their favorite beverages. And Dogfish jumped in and ended up promoting Red Cross through the way Red Cross handled the self-inflicted wound, and they raised tens, if not hundreds of thousands of dollars as a result. So I think some people are too worried about either a self-inflicted mistake or a problem because of hacking. I think what's more important is to think about how you can creatively and quickly respond when something like that happens.
I think Alden brings up a good point. I don't remember who said this, but I was at a presentation, and I think a lot of organizations and hospitals, the first thing is create policies of how you're going to address these issues. We're an advocacy type campaign, organization, project. We don't address patient concerns. And we do occasionally get the, patient consumer tweets being like, how do I get this? Or my doctor did this. And, our policy is that we don't respond directly about their patient care, but really say, we're not a provider, or we simply say, here's a link to, your local DPH or DSS thing. So create policies to prevent you from getting into trouble in the first place. But the web is really self-correcting, and what Alden was saying was that don't be afraid of negative comments. When I first started this job, I was like, oh, people don't like me, and I was like very concerned about the fact that people don't like health justice, safety. But for every negative comment you'll get about 5 positive comments defending your brand.
That's what I was mentioning. Even with our, we have very specific guidelines, especially as I educate people on how to use it. It's, again, when to respond, when not to respond, and in a lot of cases, hopefully, the public or other people will correct it if it's actually wrong or provide their, information or experience that might contradict it.
Or a communications check, get your friends to respond positively on your behalf.
Yes, that always helps. I had just one other question I was dying to ask, which is one of the biggest code words now in the world of marketing is the whole idea of content marketing. And I think everyone in this group now touched about this big idea that we now in the social media world have to be sort of the stewards of these massive amounts of content that's always fresh, always exciting, always new. How do you guys deal with that? What's your secret?
I was going to say, I don't have the secret. It's one of our biggest challenges, especially when we deal with so much different types of information. And it's where, again, we really try to educate people and get people that are advocates and are able to provide us information, updating their own web page, providing information for our social sites. And it's difficult. We're relying on nurses and doctors, and guess what? Social media is not their priority. They're bedside. They got 1 million patients that they're dealing with. So it's a challenge every day that we deal with, especially being, having a department that isn't very, highly resourced. But the more that they see that it does benefit them, there is some communication, people appreciate it, they start to warm up to it, they understand that bad information is harder to deal with than providing new information every once in a while. So we're working on it, but it's an issue that we continue to try to find answers for.
Let me just respond that one of the things that I think is really important is come at it from a journalism background. I view my job as social media manager for the Community Health Center as being essentially the editor-in-chief for the CHC Daily News, right? And I am out there, I am looking for stories. And I'm looking for stories that if I have to write them myself, I will write them myself. But if I can find people, and initially I start off by finding sources, right? Good journalism, you find sources, you get the stories, but then the next step is you get them to maybe start becoming writers themselves. And so that's been an important part for me in terms of thinking of social media as, you know, CHC Daily News. And the person who does PR for us, it's always, Eliza, send me every press release. Treat me like you'd treat any other journalist. And so I get stories that way. In terms of the doctors and nurses, trying to get a doctor to write anything, challenge. If you do get them to write something, you're going to have to completely rewrite it. Medical assistants. If you're in healthcare, you got the medical assistants, you know, the first person who sees the patient in the room, and they're chatting with the patient, and they're taking the blood pressure, and they're getting the stories, and they love to tell those stories. You give them an opportunity to tell the story in an appropriate way, that becomes a blog post, and hey, that's big, and they get on board with it. Because they're going to tell the stories either at the water cooler or to you. Get them to tell it to you in a way that you can share it.
Right. And even better is getting the patient to tell the story, as I mentioned before. You know, anything we can get out of them, that's what people, especially on the social side, that's what they react to, that's what they want to read and hear about.
So, Jen, I was going to say, do you want what you should do, or what do I do? Because there are two different things, because my boss is on my back for an editorial calendar. It's always good to kind of lay out what your editorial calendar would look like. It's not really realistic because the news changes every day. You know, ideally, like, yeah, February for us, it's Black History Month, it's Heart Health Month, it's all of these various months. But guess what's more important than all of these health months that are on our editorial calendar? It's gun violence. It's the immigration reform that's going to impact our health in the future. And so it shifts. So my rule of thumb, you have at least 2 or 3 backups, and I'm running out of backups, but have 2 or 3 backups, and there are various stories that you can do. At the very least, what I like to do with some of my contributors who are running ideas, I'd say, oh, here's an interesting article, why don't you respond to that? That's a good one. A response to an article or a response to a new study is a good topic, highlights from what they've learned. You've got to make it easier for your writers. Like Alden, I'm kind of the editor-in-chief, and I don't have staff, so they're all volunteers, so it's almost twice as hard getting volunteers to get you stuff on time. But there's always this exchange of goods type work when you think about it, when you think about kind of organizing in that way.
Yeah, follow what's going on in other social media, news. Use your blog reader. You know, I track over 1,000 blogs. I follow 3,000 people on Twitter. So there's a constant stream of information coming in, and it's sort of like, okay, which ones are good stories or good sort of catalysts for somebody else to start a story?
And make it easy for your writers to write. You know, interview them, write the blog post for you, interview them over the phone, record it. You know, a lot of the times I turn emails of venting into a blog. It's really interesting. I'm like, can I turn this into a blog? And I mean, you really just gotta keep it up there. So there's stories every day.
Well, thanks very much, everyone. This has really been very insightful, very interesting. We could go on forever, but I think our time is beginning to fade away. Really appreciate your time, and you know, we'd love to touch more into the subject. Our next breakfast, by the way, for those you're all on the mailing list now if you're here, so you'll get the mailing. Will be on April 5th, and we're going to be doing our famous social media Iron Chef breakfast, where there's going to be a secret charity that's going to come in, and 3 social media marketers who are going to have half an hour to develop a plan for that charity. It's a lot of fun, and you'll get the notifications within about a month or so. So let's thank our panelists again very much. And thanks for coming.